can't get the feeling of being in the water anywhere else. It's just magical.
People always refer to swimming as flying. So if you want to relate flying to magic, then swimming is magic.
There's magic in the water here because it gives me confidence.
I know when I'm in there, it's just different. It's peaceful.
It is magical for anybody who's willing to go in there and just enjoy being in the water.
We service all age ranges here.
We see pediatrics all the way up to, geriatrics in the water.
You'll have your swim team, and then your master swim team. You got your lap swimmers, and then there's usually a therapy pool, which you get people with disabilities.
Some people like to dive. Some of them are long-distance swimmers.
We have athletes that have a disability or have a special need.
Pediatrics, we see autism, cerebral palsy, Down syndrome, developmental delay.
So there's everything from rowdies here, i.e. the water polo, to the peaceful people who are just trying to do laps and swim.
Often a child who's born with a disability thinks, their parents think they can't do a lot of things.
I was born with congenital hip dysplasia, and my mom put me in the water after my 3rd surgery. Frequently with this, legs will be uneven lengths, and mine grew evenly, and they accounted that to her putting me in something when I was younger.
When I started here, I was in a wheelchair, but now I'm in a walker. And my goal is to walk without canes.
One day, my mom took me to the hospital, and I had cancer, and now I'm happy because I can swim and I don't have to drink a lot of my medicine.
My 3 brothers and I have hemophilia. It's a blood disorder where basically your blood doesn't clot.
And so what happens is when I get an injury and I can't clot, that injury will stick around for longer periods of time.
Our doctors just basically prescribed swimming as our medicine.
Since I've been swimming, the muscle around my joints have gone larger, and so my chances of getting injuries is decreased.
For our geriatric population, physical rehabilitation on land, it hurts. It doesn't feel good all the time. And to sort of supplement that work that they're going to have to do to get back to walking or playing with their grandchildren, they're going to need to get in the water.
I had a stroke, and the stroke left me paralyzed where I didn't have any body movements or anything for a couple of weeks. I was unconscious, and I've slowly built myself back up by doing exercises on land and in the pool to try and to get some reasonable capabilities of being a human being again. And it's helped me tremendously.
Our bodies lose that kind of connection, and when you do an exercise like swimming, it really starts to work, get your body to work all together. And it takes all of these pieces, but that nervous system being the one that really controls everything, that one's so important to have it all kind of functioning together and working together for your best health.
We also offer classes for arthritis, multiple sclerosis, Parkinson's.
Hip and knee rehabilitation classes, so popular, waiting lists for days.
We also have a spine hab class and cervical spine hab class, and those are also for pre and post surgery.
A lot of our land-based athletes are getting in the water and using it for recovery.
We can rehab almost any sports injury in the water. Shoulder injuries, low back injuries, ACL injuries, MCL injuries, ankle sprains.
When you get in the water, it's actually helping to reduce swelling. So the hydrostatic pressure actually pushes the fluid back up into your lymph tissue, so your swelling is reduced, which you're going to heal faster.
We have less gravity in the water, so that decreases pain, and they're able to move better because they feel better. And once we get people moving, emotionally, psychologically, they're happier. The water is a great way to rehab.
Psychologically, the pool offers a sense of well-being and a sense of just calmness.
In 2013, in the fall, I was diagnosed metastatic de novo breast cancer, and the pool definitely became my solace, my zen, my place to be. The water is where I felt the most free and the most disease-free.
In January of 2015, I was diagnosed with stage 4 lung cancer. My prognosis was 6 to 12 months. As part of that, and in fact, the very next day after my diagnosis, I got back in the water. It was like I was going home.
Sometimes the pool is just a nice place to relax or to talk with other like-minded individuals that are kind of maybe going through something similar.
What I discovered in the process of continuing to swim was that the teammates that I swim with, they turned into my support group.
It's kind of like meditation. It's a chance to really kind of just let things go.
Sometimes we just want to go out and float, and that's healing in itself.
Water is the best form of exercise for a lot of people.
Whether you're going to be just in the shallow end doing shallow water aerobics, or you're going to get in and swim, but you're going to swim your pace. You're going to swim 1 lap at a time, and you're going to start with 4 laps, and that's it. It's a great workout.
For someone that, let's say they're overweight, and their doctor says, oh, you really need to lose weight so that you can decrease the pain in your joints. But they can't exercise on land, and they say, well, what am I supposed to do? So the pool is the best place for them to do that.
If you go to the aquaticpt.org, you can find a PT in your state that practices physical therapy in the water. I would also suggest contacting your local YMCA. Usually people are most nervous about coming to the pool is getting a swimsuit on, afraid of what other people might think, afraid to get their hair wet.
You do not need to know how to swim. You do not have to put your head in the water.
I think all those fears are usually diminished once they come to the pool. They see other people that have very similar issues. There's all shapes and sizes and ages and diagnoses, and so I think once they get to the water and they feel the benefits of it, all those fears go out the window. Once you get in the water, no one can see you in your swimsuit anyway.
You're thinking about it, so you're interested, but you just don't know if you want to swim or not. I would suggest just trying it. Get into the pool and swim a little bit, get into the shallow end and just kind of move around and see how your body feels doing that. And I think you'll find that you'll really enjoy it.
Somebody like me who had a stroke to make me whole again, all of these things can happen in a pool.
Do it. You will find that you really like it, because I've found that everyone that has come that I've talked to that didn't do it before fell in love with it.
Just come on down and check it out. I would highly encourage everybody just to experience the water.
Give it a shot. You'll be amazed at what you can do.
If someone said to me, I'm thinking about going to the pool, I would say, I'll give you a ride.